Somebody comes with a urine report of pus cells 10 to 15, it's UTI. The PYURIA UTI reflex is deeply ingrained in the clinical habit that often lead to overdiagnosis and unnecessary antibiotic use. Let's today discuss the pitfalls in interpreting PYURIA as a UTI. Let's discuss about the sensitivity and specificity of PYURIA. The primary fallacy lies in treating PYURIA as a diagnostic equivalent of urinary tract infection. While PYURIA is highly sensitive of UTI, it lacks specificity to be a diagnostic marker. Let's see the sensitivity. Almost all women with symptomatic UTI will have PYURIA. While coming to specificity, many women with PYURIA do not have UTI. The main pitfall is that why PYURIA UTI thinks us astray is that we solely depend on PYURIA or a positive dipstick for leukocyte esterase and classify it as UTI. A symptomatic bacteria will have PYURIA. In many populations like elderly women, patients with catheters, the bladder is colonized. And when colonized by bacteria, there will be triggering of immune response and PYURIA. Treating them is generally more harmful than leaving them alone. Then comes the condition like sterile PYURIA, where many conditions there will be pus in urine without bacteria and UTI. The commonest condition is sexually transmitted diseases like chlamydia and gonorrhea, which presents as dysuria and PYURIA, but culture would be negative. Then the inflammatory conditions like interstitial cystitis and pelvic inflammatory diseases, they also present with PYURIA. Structural lesions like nephrolithiasis or urothelial tumors. The limitation of dipstick is that whenever there is PYURIA, the dipstick would be positive. This could be due to vaginal contamination of skin cells or discharge or highly concentrated urine. So what is the alternative approach? So modern guidelines emphasize UTI on a clinical diagnosis, not a laboratory one. Focus on the triad of dysuria, frequency, urgency. When women have all these three and no vaginal discharge, the probability of UTI is more than 90%. Or you can use a more specific McGear criteria and avoid reflex testing and treating. So finally, taking PYURIA as a surrogate marker of UTI can be very dangerous. So the main key takeaway that you should have that treat the patient, not the dipstick or the PYURIA. If they have symptoms of PYURIA, if they have no symptoms, PYURIA is usually irrelevant. If they have symptom, treat it, except in pregnancy and prior urological surgery where asymptomatic PYURIA can be treated. And there is always the vaginal interference. Always ask about vaginal itching or discharge. When present, the likelihood of UTI drops significantly, regardless of what the urine looks like. Culture is always a king. A positive culture with PYURIA in an asymptomatic is still asymptomatic bacteria, not a UTI.